Welcome back to Coffee Talk with Mike and Janelle. It is episode 27, and today we're going to be talking about an article in Parents Magazine, which is parents.com now, that Michael was featured in discussing a new medication that has been trialed in treating autism. The medication actually has been around for a long time. It's Lamictal, also known as lamotrigine. It's an anti-epileptic medication, and Dr. Cummings is going to talk a little bit more about this.
Yeah, so it's a really exciting study on some levels. And the magazine article, or now, as Janelle alluded to, it's all just online now. So the article on parents.com, which came out a couple months ago, I think in March, talks about, and you always get these bylines of like new treatment for autism. And it's very exciting on many levels because all research, essentially all research up to this point for autism, is not about treatment, right? It's about genetic studies, finding causes. And while that's important to families who are really struggling, particularly with a child or loved one with severe or profound autism and with aggression, it's great that you can figure out how to identify someone, but we're hoping that you can come up with treatment.
Right, we need help now.
Exactly.
Yes.
So the byline is really exciting, and really what it is, it's a study out of Germany where they're looking at a gene's a MYT1L gene, that's already been kind of described, and interesting enough, humans who have a defect in this gene are typically autistic. So if you have the defect that they're looking at, you probably have autism. There's a syndrome associated with it, autism, intellectual disability, typically obesity, a couple other things. But it's a very rare gene. I mean, there's only about 200 cases described in the world up to this point.
The whole world,
yeah.
Wow.
Okay. And it doesn't mean if you didn't test everyone in the world with autism that there might be more, but it's certainly not.
It's just certainly not well known.
A common cause of autism. So they have this line of mice that have this same defect. And we use mice models often, and even in studies, they'll use autistic mice, which means that they phenotypically look like some people with autism. And by phenotypical, if people don't understand, your genotype is your genetics. So let's say we're talking about Down syndrome. You have 3 21st chromosomes, trisomy 21. So that is Down syndrome. That's your genotype. Your phenotype is what a classical individual with Down syndrome would look like.
So how you visualize it.
How you appear on the outside.
Yes.
So there are plenty of mice lines that are phenotypically autistic, but what that really means is they don't socialize with the other mice. They maybe have more hyperactivity. They look like some kids with autism in a mouse world. It doesn't mean they have autism, right? This is a little bit different because a human who has this defect in this gene will have autism. So these mice have the same defect and they act phenotypically autistic. And when they gave the drug, Lamictal, lamotrigine, which again, Janelle alluded to already, anticonvulsant or anti-epileptic, also used as a mood stabilizer in people with bipolar disorder, typically bipolar depression, but bipolar disorder in general. When they gave the mice this med, it appears to at least accommodate or fix the metabolic deficiency that's occurring with this gene, and the mice no longer appear phenotypically autistic. They start acting like neurotypical mice. So that's exciting, right? I mean, it's exciting from the standpoint of here's a study, it's something that is changing behaviors, at least in this animal model, of mice that already have, if you will, autism. Unlike anything else we have. Right now we have kind of prevention and we don't really even know what really causes autism. And then autism is thousands of different things. So it's exciting from that standpoint.
It certainly is, but obviously not every medication is going to work for every individual or every situation. So how is this applicable to our families and the people that we treat day to day?
Well, again, let's be cautious about this, right? It's a well-done study. It's an exciting study for all the reasons I've mentioned, right? Again, autism is probably 1,000 things. So if you have this one variant of autism, and again, there's only 200 cases described in the world up to this point, doesn't mean there's not a lot more, but there's only 200 cases. then this medication may be helpful for that purpose. But the caveat to that is a couple things. One, it is probably still a relatively small portion of people with autism that it may be helpful for. And two, fully 1/3 of people on the spectrum have a seizure disorder, many of whom are given Lamictal for that purpose. It's a very good anticonvulsant or anti-epileptic medication. And we are not seeing these changes generally in the population.
Right.
So like many other things, and it's the reason why we talk about genetic testing all the time, because anyone with an intellectual disability that we can't identify the cause for should have genetic testing.
Yes.
That's American Academy of Pediatrics, that's been their statement for a decade. It doesn't happen, but it should.
Yep.
If you had this rare variant, you know what? This could potentially be very helpful. If you had the phenotype that goes along with this MYT1L syndrome, which you could just Google, but it tends to be autism, intellectual disability, obesity. There's a lot of reasons for obesity in the autism world, so it doesn't mean simply because of that you have this. Or if I was considering adding an anti-epileptic or a mood stabilizer, I might lean toward, if everything else is equal, maybe we lean toward Lamictal as opposed to one of the other ones.
First line instead of another.
Yes. But day to day, I just, I worry about these things in the popular media because, again, these articles are built to sell articles. Yeah. And so it's very promising, it's very exciting, but it probably doesn't have a lot of applicability to most of the families we work with.
So it may be a titch deceiving in the fact that it just works with a really slim amount of folks. Yes. But hey, it's still hopeful. They're obviously doing this research, and we're hoping to continue to move in this direction and finding
absolutely
options.
And there's other medicines out there that are starting to get published that have been used for other reasons, some chemotherapeutic agents, some other things that have shown similar improvements as well. So I think the really exciting thing is the research is starting to move in the direction of not just identifying, but treatment. And that's exciting. But does this have an effect in the next 5 to 10 years? Maybe, maybe not. But at least we're finally starting to move in the right direction.
Perfect. Hey, we're moving. That's all that matters.
Absolutely.
Cool. Well, thanks for participating in our Coffee Talk episode 27. Until next time.
APEC out.
APEC out.